Okay, great. Good morning, everybody. All five of us. My name is Joyce Case. I'm with the Health Planning Council, and we're here to talk about the Affordable Care Act and the American Rescue Plan, which is really quite incredible. Some of the changes that have occurred just within the last month. So let's just get right to it. The first thing I want to talk about, and I would be remiss if I didn't talk about the Health Planning Council and what we do at the Health Planning Council. We're a regional health planning organization mandated under Florida statutes. Our board of directors are actually appointed by each of the county councils in each of the 7 counties that we represent. Our headquarters are in Jacksonville, and our service area include the 7 counties in this Northeast Florida corridor. We've been around for a long time, 40 years. We used to actually be a state entity, but we're now quasi-state. So we can do a lot of things that for state and government entities without having to go through the bidding process, because we are quasi-state. So if you ever have that opportunity to use the Health Planning Council and the services that we have, think about that, because we don't, government entities don't have to go to competitive bidding for using the Health Planning Council. So let's talk about the American Rescue Plan. Why is this not working? So let's do that. Did that work? No. All right, let's try this. Okay, the American Rescue Plan. Let's talk about it. What is it? That's going to be part of this presentation. We're going to talk about what the American Rescue Plan is in its relation. There's lots of components to it, but it's in its relation to the Affordable Care Act. It is advanced premium tax credits are involved in the American Rescue Plan. And if you don't know what the advanced premium tax credits are, we'll talk about that really briefly. It's gonna affect Cobra, which is insurance that people can get after they leave employment and can keep the group policy that they were on. It's gonna affect that. It's also gonna have some changes to Medicaid. And this one is a good one. I think you guys will like this one. And then the stimulus payments, enhanced unemployment, and premium tax credits. So as opposed to advanced premium tax credit, regular tax credits. Okay. So the American Rescue Plan was signed into law on March 11th. So that's how soon this was. And things, its intention is to make the marketplace insurance more affordable. It's going to subsidize Cobra premiums. I don't know if any of you ever have tried to go on Cobra, but Cobra is very, very expensive. And so the federal government is offering to subsidize people's Cobra payment. The changes to Medicaid is allowing states to expand Medicaid to offer coverage to women for up to 1 year postpartum. Right now, it's only 60 days. After they have the baby, they're on Medicaid. After 60 days, they're off Medicaid. This American Rescue Plan is going to allow women to stay on Medicaid for 1 year postpartum. It also is extending the unemployment compensation, and it is providing stimulus payments. Some of you may have already received those. And I'm sorry, I'm looking about my bullet points at the bottom. So if you've had that, so this is all the American Rescue Plan, and all of these things have a factor in the Affordable Care Act. So it's interesting how it all ties together. Okay, so the Patient Protection and Affordable Care Act, a lot of people, we refer to it now as the Affordable Care Act. It was passed in 2010, and the federal insurance marketplace opened in 2013. back in 2010, you probably didn't really notice a lot of things that happened with the passing of this law. It's a 2,500 page regulation law that regulates healthcare. But one of the things that it did with in relation to health insurance was between 2010 and 2014, it was going to take away the issue of pre-existing conditions. Pre-existing conditions, insurance companies could impose a pre-existing clause when someone went without health insurance for more than 61 days. So if you lost your job and you didn't have, and you didn't Cobra, and you had gone without health insurance for 61 days, and you had something that was a pre-existing condition like a heart disease or diabetes or high blood pressure, the insurance company would say, a new one would say, an individual policy, not group policies. Individual policies would say, oh, you've been without health insurance for more than 61 days. And so we'll cover everything regarding your health except this one disease that you have. So that's one of the things that the Affordable Care Act did at that time, was it was going to, over time, outlaw it. So by January 1st of 2014, insurance companies could no longer discriminate against people for pre-existing conditions. The other thing that happened, well, you know what's really interesting too, we talk about what pre-existing conditions are. Well, one of the number one pre-existing conditions that they discriminated against wasn't diabetes, wasn't heart disease, wasn't cancer. It was being a woman. Insurance companies always charged more money for women than they did for men. And that went away as effective January 1st, 2014. The other thing that you might have seen at the passing of the Affordable Care Act was copays. You no longer had to pay for preventative medicine. So right away, you no longer had a copay for your mammograms, for your pap smears, for flu shots. Anything that was a preventative medicine, a proven preventative medicine, was no longer going to be able to have a copay associated with it. So those things happened immediately, but a lot of the other things came into play as of January 1st, 2014. And so that's when the Affordable Care Act, the health insurance marketplace, opened October 1st, 2013. At the same time, the marketplace website wasn't working for the next 90 days. The government shut down for 2 weeks. It was crazy, but we got through it and we got lots of people enrolled. Our organization right now, we have a contract with the University of South Florida, who has the federal grant with the federal government, and then they subcontract with 8 partners in the state of Florida to provide the services statewide. Under the Patient Protection and Affordable Care Act, one of the things that is part of it is that there are advanced premium tax credits. And we talk about that kind of because we are in the industry and whatnot, but advanced premium tax credits means that the federal government is going to advance you a tax credit so that that'll be applied directly to your premium payment to reduce the cost of your premium payment. So it's advanced. And so initially, when we had people enrolling in the marketplace, what happened was we had a lot of people that hadn't filed taxes because they didn't meet the income threshold. And so we had to tell them, you need to file your taxes in order to get this advanced premium tax credit. And those tax credits were available for people between 100 and 400% of poverty who also met some other income, other eligibility requirements, like you have to be a U.S. citizen or legally present to be here. So that's a little kind of synopsis of the Patient Protection and Affordable Care Act, commonly called today as the Affordable Care Act, and some people even still refer to it as Obamacare. So ARP, I want to call it AARP, but ARP has the advanced higher, they increase the advanced premium tax credits. So consumers with income between 100 and 150% of poverty will be eligible for zero premium benchmark plan. That's after the advanced premium tax credit. So what that means, zero premium, meaning free. I heard a pastor at one of the presentations that I went to, and he was talking about his services at no charge, and he said it's free 99. And so it was great. I said, I'm going to take that, because that's what this is. It's free 99. It's free. The advanced premium tax credits for this population between 100 and 150% of poverty, their premium payment, and this would be mostly in, we want them to be in silver plans, and I'll talk about that later, but their premium payments would be free. So that's really important to know. Okay. Consumers with incomes over 400% of poverty. And remember, I told you in the previous slide, we said that advanced premium tax credits were between 100 and 400% of poverty. Well, the American Rescue Plan is allowing for consumers over 400% of poverty to now be eligible for the advanced premium tax credit. And they're saying it's for plan year 20 this year and next year, and there may be some extension later on. People who receive unemployment benefits will be eligible for free, zero premium, zero benchmark plans after the advanced premium tax credit, and they will receive the highest cost sharing reductions, regardless of what their actual income will be. So if you've received one unemployment check, you're going to be eligible for free health insurance. That's really key. We're going to talk a little bit more, go back into that. Cobra subsidy. This is another huge thing. Cobra subsidies. 100% of Cobra premiums will be paid by the federal government for people who qualify for Cobra. And we'll talk about that a little bit later too. This is good for April 1st through September 30th only for the Cobra subsidies. Then the repayment forgiveness. So people who have underestimated their income for the Affordable Care Act. So you have to estimate your income for the year. And we have folks that have variable incomes, which that's fine. But sometimes they have difficulty estimating exactly how much they make. And so the federal government gives you an advanced tax credit in order to reduce the premium payment based on this income. So if you underestimate your income, and let's say you make $1,000 in a year, and of course that's not the real money, but if you made $1,000, or you tell them you're going to make $1,000, but you really make $2,000, the federal government is giving you a tax credit based on the $1,000. And so what they want is, they say, well, if you made $2,000, we want that tax credit, that we want you to repay that, because you shouldn't have gotten that big of a tax credit. They are forgiving that repayment that usually happens at tax time. So they're forgiving that, and they are giving that back to consumers who have already filed their taxes. Right now, that's only for plan year 20, for this past year, 2020. It may come around for 2021, but right now it's just for people who underestimated their income in 2020. So new for the American Rescue Plan makes the advanced premium tax credit available to households above 400% of poverty, and caps how much the household income the family will pay towards the premium payment, which is at 8.5% of their annual income. It's not a lot. I've done some people who are above 400% of poverty, and it's their insurance is still pricey, but some of them, it's more affordable than if they didn't get the tax credit. And this is applicable for this year and next year. So people above 400% of poverty will also get this advanced premium tax credit. It's great. So also new this year, the American Rescue Plan reduces the percentage of households' incomes at all levels. So everybody who is currently enrolled in the marketplace, and those who currently qualify, it is it is going to reduce the household income, thereby making the advanced premium tax credit higher so that the premium payments are lower. It's a whole math thing that is hard to understand, but That's it. So tax households. So I'm going to repeat this a couple of times. Tax households with income between 100 and 150% of poverty. Let me tell you what that is. That is, so for one person, and I will tell you this also, the marketplace uses FPL for last year until November 1st, open enrollment of this year. So we are still going by 2020 FPLs, even though they've published in the Federal Register the new 2021 FPLs. We are going by old 2020 FPLs until November 1st. So one person between making $12,760 a year to $19,140 a year will qualify for premium payments of zero, free 99, free health insurance. This is really, really, really important. There's a lot of people out there that would qualify for this right now. And we always use tax households. So we're not looking at if there's 5 people in the household. We look at a tax household, not like an eligibility program. So keep that in mind when you're looking at folks that could be eligible, and send them to us because we can help them and we can figure all the math out. Okay. 4 out of 5 enrollees will be able to find a plan less than $10. I'm telling you, it's pretty. It's like the first couple of years we were doing the ACA. Plans were really, really affordable back then, and they're now affordable again. I've had lots of people who enrolled in bronze plans, and we'll talk about that later, but enrolled in bronze plans because they could no longer afford the silver plans. And even though they were getting better savings, they could not afford that monthly premium payment. So now they will be able to afford those silver plans because they'll most likely be under $10. This is talking about over 50% of the people that we enroll will be able to find a silver plan under $10 a month. It's unheard of. This is for both plan years 2021 and 2022. All of this stuff is effective April 1st. So going forward, April 1st, these changes occur then. The tax credit, though, is not automatic. So if you know anybody that is enrolled in the marketplace, they have to actually go into their marketplace application to make these changes if they want it to occur now. Okay, so if someone were to go in and make their changes to their marketplace application during the month of May, the new payment will occur starting June 1st. If they do it in June, it'll start in July. The other interesting thing is it doesn't go retroactive. However, people will get this tax credit when they file their taxes for 2021 next spring in 2022. So they will get the tax credit for January through whenever they do it. If they choose not to do anything, they will get this tax credit for the whole year. If they do it through June, they'll get 6 months when they file their taxes in 2022. Okay, so for unemployment, the American Rescue Plan also extends the federal pandemic unemployment compensation to $300 per week for individuals who are collecting unemployment. So, you know, folks that are currently on unemployment, they'll be able to still get this, the federal unemployment compensation. I know the state's looking at reducing theirs and having some end dates. So most folks will still be able to get the $300 a week for unemployment from the federal government. The unemployment should be reported on the marketplace because we're using that to help them qualify for these zero-based plans. It does not affect their eligibility it's not counted as income when they're applying for Medicaid or CHIP. And it also is not counted on the marketplace for this. And then these unemployment compensation payments will be good through September 6th of this year. The American Rescue Plan also increases the premium tax credit assistance for most filers and who are approved to receive unemployment compensation for at least 1 week beginning in 2021. So if you have one person that has received at least one unemployment check, they don't have to receive any more. They've received one unemployment check. The marketplace will treat these consumers as if they have an income of 133% of poverty. So remember, I told you that people between 100 and 150% of poverty qualify for free health insurance. Folks who have received at least one unemployment check, one, it's all they have to receive, and they will receive unemployment. Free health insurance until the end of the year, and it'll go through next year as well. These consumers will need to provide the IRS their unemployment statement, and we probably will have to upload that into the marketplace eventually. Right now, they're not asking for proof. They will also meet the criteria for cost sharing reductions, which in the silver plans, that they have extra help through the federal government to reduce the copays and the deductibles. And so these folks can really qualify for some really good health insurance at this time. Consumers receiving unemployment with income under 100% of poverty who may not be otherwise eligible for Medicaid will be eligible for the advanced premium tax credit on the marketplace through 2021. This is applicable for this year only. So there's going to be some additional savings. This is also through the American Rescue Plan. I mean, the stuff is really, it's overwhelming almost, the amount of available assistance to consumers. So additional savings will be available through the marketplace, and they're through later this summer. So they may be available for some additional assistance later this summer for those that are on unemployment. All they have to do is apply for the marketplace. We'll count all of the unemployment compensation. We'll put it into the marketplace, but it will not calculate it as income. It'll be calculated as if they have an income of 133% of poverty. Okay, let's talk about Cobra. This is another thing. Oh my goodness. I mean, Cobra. So Cobra stands for something. Actually, probably didn't know that, but Consolidated Omnibus Budget Reconciliation Act of 1985. This was passed right after I got out of college. And this allows employees and their families to keep their group health coverage at the group rates temporarily, depending on some qualifying events, but they have to pay for it. It's like if you leave your company, and employers, the idea of Cobra was that some employers may actually help the employee with paying for some of the Cobra premiums, but that really doesn't happen. And it's usually the cost to the employee, and it's about 102% of the cost for the monthly premium. It's outrageously expensive. It's usually $800 to $1,200 a month to stay on a group plan as an individual. It's really, really, really expensive. So the ARP, the American Rescue Plan, is for individuals who are eligible for Cobra because of their family member or themselves left because of involuntary separation from the job. They would be eligible for a subsidy, a premium subsidy that covers the entire cost of the Cobra. Now, it would pay for that Cobra premium from April through September 30th of this year. If an employee was offered Cobra, and usually your company has to tell you that upon separation that you're eligible for Cobra. You have so many days, so much time to enroll in Cobra, and if you don't, then it's over with. You can't re-enroll. But this is allowing people who may have elected to get Cobra and then had to discontinue it because of the cost, or now they can elect to choose it. They're allowing them to go back a while to get the Cobra coverage. that would cover them. But it's usually, you usually have Cobra coverage for up to 18 months after you've left that employment. Okay. It doesn't now just because this election period, it does not, this subsidy does not extend Cobra. It doesn't change any of the parameters around Cobra and how you might be eligible for Cobra. It still has many things in place for that. You can you can elect to have this coverage effective April the 1st, but companies are going to have to notice you if you're even eligible for it. So that's one of the things that even though April, it may go retroactive to the April to pay that one payment in April, even if you found out in May or June that you were able to elect to have Cobra. Individuals who are eligible for this extended Cobra election period will receive a notice. So you will be notified if you're even eligible for this Cobra. And not everybody will qualify for it because you have to have had insurance and lost it through your company in order to qualify. Okay. The notice will provide additional information about the premium assistance and how to request it. And you'll be given a time frame of how you can elect to take this. You have 60 days from the time that you get noticed to elect for this Cobra. If you're eligible for Medicaid or eligible for the marketplace, this does not affect your eligibility for Cobra. So if you want to take that Cobra, you can, but and you're not going to get the premium payment. It's not going to be paid to you. It's going to be paid to the insurance carrier. Okay. If you're eligible for like you've gotten another job and you're now eligible for this new group policy at your new employment, you're not eligible to go back and get this premium payment for this other Cobra policy. You're not eligible for that. People who receive the Cobra premium subsidy and are not supposed to receive it, the federal government is going to want it back, and you'll get that in the form of a tax penalty. So most folks, if you want this, make sure you qualify for it, and just make sure that you get the notice and you follow all the guidelines for the Cobra. Now, the American Rescue Plans also require that, and this is when they'll, and this is actually required all the time. You're supposed to be notified by the insurance carrier that your Cobra is ending, that it's terminating, and you usually get that notice within 45 to 60 days of it ending. And so but you'll get this notice. It's not really the ARP that requires it. It's actually the Cobra law that was passed in 1985. They're required to do that. This is normal, but it is eligible. You will be notified within those days, and then you'd have to make decisions on whether or not you are going to elect to take other coverage or get a new job through your group policy. So Cobra does end, and you have to have a plan for what you're going to do for coverage after the Cobra ends. Changes to Medicaid and CHIP. So the American Rescue Plan is allowing states for the next 5 years to extend a pregnancy-related Medicaid and CHIP eligibility to 12 months postpartum. Right now, it's 60 days. And it's up to the legislature of our state, who I found out last week has decided that they are going to go for this extension and allow it to occur in our state. So women will be eligible for Medicaid 12 months postpartum, which is a really, really good thing. Consumers may receive a stimulus payment. These are about the stimulus payments. It's not included in household income on healthcare.gov, and it does not affect your financial assistance for health coverage through the marketplace or eligibility for Medicaid or CHIP. And that's really important. Folks, I don't want them to be confused by that, thinking that, oh, this is going to add income. It's going to take away my Medicaid eligibility. If that's happened to anybody, they need to let someone know, because that's not supposed to happen. So in summary, the stimulus payment upon enactment, it's already passed, and most people have already received their stimulus payment. In fact, I got a letter from Joe Biden talking about that. The APTC, it's for plan years 2021 and 2022. The extension of the federal pandemic unemployment compensation is good through September 6th of this year. Unemployment compensation enhances advanced premium tax credit and cost sharing reductions for plan year 2021 only. And Cobra Subsidies, April 1st through September 30th. And the extension of Medicaid to pregnant women is going to go through 2027, which is really, 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 really great news. So let's talk about how people can get appointments with navigators in our region and in Volusia County. We do virtual and phone appointments, and I'll have to tell you that this occurred long before COVID. We were doing this because we had funding cuts and no longer could travel throughout the 7-county area to do in-person assistance. And our federal grant finally allowed navigators to do appointments virtually. In 2018, we finally were allowed to do that. We were not allowed to do that prior to that. Brokers and everybody else could do phone and virtual appointments, except federal registered navigators were not allowed to do this, but now they finally allowed us to do it. So we've been doing it, and consumers love it. They don't have to go anywhere. They don't have to worry about the rain or bus schedules or anything like that. We can do it over the phone. We can Zoom with them just like this. It's really great. Here are the qualifications to be enrolled in the marketplace. You must be a U.S. citizen or lawfully present. You have to have an income of 100% of poverty or above. You must live in the geographic area. So if you have health insurance that is in Volusia County and you move to Duval, it's likely that you're going to need to change your health insurance, particularly if you have an insurance plan that is only covered services in Volusia County. Florida Healthcare Plans comes to mind. It's not available in Jacksonville, and so none of the providers would be in the network. So you would need to change your marketplace insurance, and you cannot be currently incarcerated in order to have marketplace coverage. There's no tax credit available if you have employer-based coverage, or if you have income less than 100% of poverty, or if you are eligible for Medicaid, Medicare, veterans coverage, or employer-based coverage. Those are the ones that, during COVID, when a lot of people were starting to lose their jobs, they had spouses that had insurance available to them, and they had to take that insurance. They were not eligible for a tax credit on the marketplace. So here's the federal poverty guidelines that we're currently using. It's 2020 FPLs until November 1st. This is who qualifies, and these are tax households. I can't stress that enough. You could have a household family of 5 and have 3 separate tax households. You could have grandma living there, you could have an adult child living there, and mom and dad and minor child, and that's 3 tax households, and we count them that way, not as a household of 5. So it's really important. Early on in the marketplace, people didn't understand that, and sometimes they still don't. So we want to make sure people know that the household size is a tax household. Plan coverage levels in marketplace, and I think you probably know that in your own employer insurance, they offer gold plans or platinum plans or silver plans, and in the marketplace, their plans are metal levels, and they go from bronze to platinum, and they increase with the preciousness of the metal. So bronze is not as precious as silver, it's not as precious as gold, it's not as precious as platinum. So they're all different. Silver plans are the extra. If people are between 100 and 250% of poverty, they qualify for not only an advanced premium tax credit, but they also have available to them assistance in the cost sharing reductions that reduce their copays and their deductibles. And that's really an important tax question for them. This is the type of income that we count: employment, pension, unemployment, Social Security benefits, but not SSI, self-employment, stocks and bonds, alimony, and retirement income. Right now, this open enrollment period is going through August 15th. So you don't have to meet any of the normal special enrollment criteria at all. Anybody can enroll. It's good through August 15th. If you enroll this month, your coverage will begin June 1st. If you enroll in June, your coverage will begin July 1st, and so on. All these plans will expire December 31st if you do nothing during open enrollment. Open enrollment this year will start December 1st through December 15th. Coverage will begin January 1st of 2022. And then all 2021 plans will expire December 31st. People that are enrolled in the marketplace will get these messages saying you can auto enroll, and we don't ever recommend people doing that, because we really want them to take a look at their plans, make sure that it still meets their needs. Oftentimes they're either a price difference, some of the deductibles or the copays have changed, so we really want people to take a look at their plans before they decide to stay in that plan or maybe to make a change. Here's the special enrollment information about after August 15th. People need to have special enrollment criteria. We call these life events. But all of these situations, if they got married, one person at least has to be enrolled in the marketplace. The same thing with having a baby or adopting a child. Having change in immigration status, they do not need to be enrolled in the marketplace. This is the one of the areas where you don't need to have lost insurance and you don't need to be in the marketplace. If you gain immigration status, you're eligible for a special enrollment. The other one is when you're released from incarceration, you're eligible for marketplace coverage. You've lost actually coverage if you were in prison because you were covered under the prison health system. If you move to Florida from a different state, you have to have had coverage in that state, even if it's for one day. You have to have coverage and have lost it in order to qualify for the special enrollment. If you've lost eligibility for Medicaid or the Children's Health Insurance Program, you're no longer eligible and you can then be enrolled in the marketplace and qualify for a special enrollment period. These are other special enrollments. If you've lost your job and lost your health insurance and you do not have any insurance available to you, if you were divorced and you lost health insurance, if you turned 26 and you lost coverage under your parents' plan. In the state of Florida in 2008, the legislature passed that you could stay on your parents' plan until the age of 30. That is still in effect. Federal law is 26. Florida law is 30, and it depends on the insurance companies which laws they abide by. So check with that if you have a child that might be eligible for staying on your parents' plan until the age of 30, and you want them to do that. That's an option for you. Another special enrollment is you've aged out of foster care, graduated from college, and lost student-based coverage. And lost your eligibility for Medicaid or Children's Health Insurance Programs, usually because of higher income. Here's the navigators in our area. We have a statewide toll number that you can call. And there's my phone number, Teresa's number, Susan's number, and Debbie's number. And then lastly, this is our again, we have an appointment. You can go to www.coveringflorida.org, and that's an online appointment scheduler. You can go and schedule an appointment with a consumer on that website. And I want to see if anybody has any questions, but in our last few minutes, I want to go to the website so y'all can see what the website looks like. And does anybody have any questions? Well, hey, Dorothy Maddox. How you doing? Okay, so we're going to go. I'm going to stop sharing and we're going to go to the marketplace website very quickly. Okay, so I'm going to share my screen again. Share that. Okay. Can y'all see that? The Marketplace website. So we have a tool on the Marketplace. It's called Get Answers. And this Get Answers is where the window shopping tool is. So down here, you can see this, where can I find prices for Marketplace plans? And it's right here. There's a link. And you can go here and you can put in your zip code. And it pops up Volusia County. And then you can continue. And then this is information about your household. And you can go in here and say, it's just for me. And I'm, 58. I'm not really, but I'm 58 and I'm female. And I don't smoke. And I'm not a parent of a child under 19. So I'm going to check none of these. So I'm going to go in here. And then I'm going to estimate my income at $13,000 a year. And we're going to go here. And that's, see that green box right there? A lot of people stop there and they say, I can't afford that. That's the tax credit. So that's what would be applied. The federal government will pay $910 on behalf of you to the insurance carrier so that you could see what your plans would cost. So you go here and the first plans that they put up, they're going to put up these silver plans. Look at that. It's free. This is the Florida healthcare plan. This is really, really good. It's $100, $2, $1. Look at that. $10 to see a specialist. Now, a couple other things you could do if you like playing around on the website. You can add filters, so you can look at all the silver plans. You can also go here and you can say, I want to just look at Florida healthcare plans. You can pick what carrier you want to look at if you want to do that. You can also add medical providers. So we can add let's see, we can add Erica. Erica O'Donnell. And let's see what it does here. She's not in that. It's an X. So let's see if we add another. Let's see. Hey, not here anymore. Give me a doctor, any doctor. Nobody knows a doctor. Okay. So anyway, so you can find your doctors and, oh, I know, I'll put in, oh, not him, remove. So it'll come up and it'll show you those. And so here, Dr. Gilroy, you can see the difference is a green check mark. So he's in this plan. So you can also go up here and you can compare plans. You can pick up the 3 plans and compare them. And you can go up here and compare these 3 plans side by side, just like you can at Best Buy. So it talks about all these plans. See the differences in all these plans? You can see that they're HMO. These are bronze plans. See, so these are plans that look at these high deductibles, high individual deductibles, they're out of pocket max. See, they have an individual total here, these bronze plan. And to some people, this looks really good, but where they took this $0 deductible, they put in, let's see, we'll look at the plan documents and we'll look at these, and where they put that deductible is in the pharmacy. They put another deductible right there. You see it, $7,200 deductible for pharmacy. So the bronze plans may look really good to somebody, but they may not be the best plan for somebody to pick. So it just sort of gives you an idea there of of what folks can get to. And we can probably go back here and I'll show you one other thing. See what happens when you smoke. We're going to take this same person and $13,000 a year. They still get the same tax credit. Everything's the same. But these are bronze plans. Let's look at the silver plans. See what smoking does? So this person, the only free plans available to this person is going to be bronze plans. So what we need to do is help people realize what they need to do. There's a question on the marketplace that talks about smoking and having smoked 4 or more times in a week. And if we can get them to do that less, to meet that criteria, we can put them in as a non-smoker. You know, we don't have to have them quit, because a lot of them don't want to quit. I have a sister-in-law that fired her doctor because her doctor always talked to her about quitting smoking. She doesn't want to quit smoking. So let's get them to cut back so that they meet the criteria for the marketplace. All right, guys, that's it. That's all I got for you today. Does anybody have any questions? I saw most of the people are people that I work with. So thank you for coming, Dorothy Maddox and Tracy.
Thank you so much, Joyce. If anyone has any questions, you are welcome to raise your hands. You can do that by clicking the reaction button on the bottom, and we can unmute you. I don't see any hands going up, so I'm going to assume no one has any questions. Again, thank you so much, Joyce. Thank you, everyone who attended this session. And if you have any questions, please let us know. And we also want to thank our sponsors, Advent Health, Career Source, Flagler Volusia, SMA Healthcare, Magellan Complete Care, Department of Children and Families, and the House Next Door. And I am going to put in the chat box the link for you to go back to the event page, and you can go to your next session. Again, thank you everyone for attending. And
bye,
have
everybody.
A great day.